Part A. Extract 1. Questions 1 to 12. You hear a cardiologist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. I'm Dr. K-Man Chris. I understand you're here today because you've been experiencing muscle cramps. Can you tell me more about what's been happening?
Good morning, doctor. Yes, it's been quite troubling. I've been getting these painful cramps, mostly in my legs, especially after long trips. They make it really difficult to move, and stretching doesn't seem to help. The cramps usually last for several minutes, but they leave my muscles sore for hours afterward.
I see. Can you describe the feeling of these cramps? And how often do they occur?
It's more like a sudden, sharp pain that tightens the muscle. It almost feels like a knot that I can't undo. These cramps happen at least 3 to 4 times a week, and mostly at night. It's becoming harder to sleep or even to do simple activities like walking for more than a few minutes.
That sounds quite distressing. When did you first notice these symptoms?
About 3 months ago. At first, it was just occasional, but over time it's gotten worse. I even tried some over-the-counter medicines like magnesium supplements and pain relief gels, but they haven't helped much.
Have you noticed if anything specific triggers these cramps? For example, after eating certain foods, exercising, or during periods of stress?
Well, they usually happen after prolonged sitting, like during long drives or when I'm on a flight. But sometimes, they just come out of nowhere, even when I'm resting.
And have you experienced any other symptoms?
Sometimes, yes. After the cramps, my legs feel heavy and occasionally I get a tingling sensation. But no numbness or weakness, really.
All right. Let's go over a bit of your medical history. Is there any family history of similar symptoms or other conditions like diabetes or circulation problems?
My mother had some circulation issues, but nothing as severe as what I'm experiencing. I do have a history of mild hypertension, but it's been under control with medication.
That's good to know. How about your lifestyle? Do you smoke, consume alcohol, or have any particular dietary habits that I should be aware of?
I don't smoke, and I drink alcohol occasionally, maybe a glass of wine a week. My diet is fairly balanced. I think lots of vegetables and lean protein, but I do have a bit of a sweet tooth.
Thank you for sharing that. Now, I'd like to do a quick physical examination to check your vital signs and take a closer look at your legs.
Okay.
Your blood pressure is 130/80 mmHg, which is within the acceptable range. Your pulse is regular at 72 beats per minute, and your oxygen saturation is 98%, which is excellent. Your legs don't show any obvious signs of swelling or varicose veins, but I can feel some tightness in the muscles, especially in the calves.
Is everything okay, doctor?
Based on your symptoms and the examination, it seems like you might be dealing with nocturnal leg cramps, possibly exacerbated by prolonged periods of immobility and perhaps dehydration.
Oh, I see. What can be done to treat it?
First, I recommend increasing your water intake, especially during long trips or periods of inactivity. Stretching exercises targeted at your hamstrings before bed could help prevent the cramps.
That sounds manageable.
I'll also prescribe a muscle relaxant for nighttime use and some supplements, as these can be effective in reducing the frequency of cramps. I'd like to schedule a follow-up appointment in 2 weeks.
Extract 2. Questions 13 to 24. You hear a nurse talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good afternoon, Mihiraa. I'm Dr. Randy Mayer, a dermatologist. How can I assist you today?
Hello, doctor. Thank you for seeing me. I've been having an issue with small pimples that have appeared recently on my skin. It's been quite bothersome.
I see. Can you describe in more detail where these are located and how they're affecting you?
Sure. They're mainly on my elbows, but they've also spread to my stomach and the backside of my thighs. They're small but itchy and sometimes painful, especially when I accidentally scratch them. I've tried some over-the-counter remedies like calamine lotion and an anti-itch cream, but they don't seem to help much. The itching makes it difficult for me to sleep, and I'm worried about scratching the areas too much.
That sounds very uncomfortable. Can you tell me about the onset?
It started about 3 weeks ago. Initially, there were just a few bumps on my elbows, and I didn't think much of them. I haven't changed my diet or started using any new skincare products, so I'm not sure what could have triggered this. I work in an office, so I'm not exposed to anything that might cause a reaction.
I understand. Have you had any similar issues in the past or any other skin-related problems?
Yes, I've had eczema in the past, especially during the winter months. It usually appears on my hands and ankles. My general practitioner prescribed a corticosteroid cream called hydrocortisone, which helped manage the flare-ups. But this feels different. It's more widespread and persistent.
Thank you for sharing that, Mihiraa. I'm going to take a closer look at the affected areas now. I'll start with a visual examination, followed by a gentle touch to assess the texture and any other underlying issues.
Okay, doctor.
They appear to be small, raised papules, and I can see that some areas are red and slightly inflamed, which is likely due to scratching. The texture is rougher than normal skin, especially around the elbows and the back of your thighs. Based on what I'm seeing, it looks like you may be dealing with a condition called folliculitis. This can occur due to bacterial infection, irritation, or even blockage.
I see. What can I do about it?
For now, I recommend you avoid scratching the affected areas as much as possible, as this can lead to further irritation or even secondary infection. You can continue using the calamine lotion for the itching, but I'll also prescribe a topical antibiotic ointment like mupirocin to prevent any infection from developing. Additionally, I suggest you use a gentle cleanser and avoid any harsh soaps or exfoliants.
Thank you, doctor. Is there anything else I should consider for treatment?
It's also important to keep your skin moisturized. Mihiraa, depending on how your skin responds to these initial remedies, we might explore other treatment options. Avoid tight clothing that could irritate the area.
That makes sense. I'll follow your advice and see how it goes.
That is the end of Part A. Now look at Part B. That is the end of Part A. Now look at Part B. Now look at question 25. You hear a nurse called Mihiraa talking to a patient. Now read the question.
Mr. Paul, how are you feeling today after the surgery? A bit sore, but I'm managing. That's good to hear. It's important to follow your doctor's instructions regarding pain management. Are you taking your pain medication as prescribed?
Yes, Mihiraa, I am, but it doesn't seem to be helping much.
We can adjust your medication if necessary. Let me know if the pain worsens. In the meantime, it's important to keep the incision clean and dry. Avoid touching or rubbing it.
I'll be careful. When can I start moving around?
Your doctor will provide specific instructions. Generally, you'll start with gentle walking and gradually increase your activity level. It's important to stay hydrated and avoid prolonged sitting or standing. We'll also monitor you for any signs of swelling or tenderness in your legs, which could indicate deep vein thrombosis.
I'm also worried, Mihiraa. My aunt had one after her surgery.
DVT is a common concern after surgery. We'll take steps to prevent it, such as using compression stockings and encouraging movement. It's essential to follow these recommendations and report any changes in your symptoms.
Now look at question 26. You hear a nursing manager called Mihiraa talking to a staff nurse. Now read the question.
Nurse Paul, I'd like to discuss a staffing adjustment. We're experiencing a high workload in the medical ward, and I believe it would be beneficial to reassign one of your patients to a junior nurse for additional training and support.
I understand, Mihiraa. However, I'm concerned about the impact on patient care. I already have a heavy patient load, and I want to ensure that all my patients receive the best possible care.
We'll carefully consider the patient's needs and the junior nurse's capabilities to ensure a smooth transition. We can discuss potential strategies to distribute the workload more equitably.
That's good to hear. Who are you considering reassigning?
Mr. George, a stable patient with chronic heart failure, is a good candidate. I believe he would benefit from the additional attention and support from a junior nurse.
I see. Mr. George is a stable patient. I'll be happy to help with the transition, Mihiraa. However, I want to make sure that the junior nurse is adequately trained and supervised to ensure the highest quality of care for Mr. George.
Absolutely. We'll provide the junior nurse with comprehensive training and ongoing supervision. We'll also closely monitor Mr. George's condition to ensure there are no adverse effects.
Now look at question 27. You hear a doctor called Mihiraa talking to the chief of surgeons. Now read the question.
Dr. Paul, I'm excited to discuss the potential implementation of a new surgical robot in our department. This advanced technology can enhance precision and reduce surgical trauma.
That's promising, Dr. Mihiraa. However, we need to carefully consider the costs and benefits before making a decision.
I understand. The initial investment is significant, but the long-term benefits can outweigh the costs. This technology can improve patient outcomes, reduce recovery times, and potentially reduce the need for invasive surgeries.
That's true. But we also need to consider the training and support required to operate this new technology.
We've already conducted a feasibility study and identified the necessary training programs for our surgical team. We'll also need to ensure that our infrastructure is compatible with the new technology.
That's important. We should also consider the potential impact on our staff, Dr. Mihiraa. Some surgeons might be resistant to adopting new technology.
We'll address any concerns and provide adequate support to our team. The benefits of this technology outweigh the challenges, and it aligns with our goal of providing the best possible care to our patients.
Now look at question 28. You hear a cardiologist called Mihiraa talking to a staff nurse. Now read the question.
Nurse Paul, I'm concerned about Mr. George's recent echocardiogram. There seems to be a worsening of his heart condition.
I'm sorry to hear that, Dr. Mihiraa. Have you discussed this with Mr. George?
Not yet. I want to gather more information before talking to him. I'm considering increasing his medication dosage to manage the progression of his heart failure.
That might be necessary. However, we need to monitor for any potential side effects of the increased medication.
Absolutely. We'll monitor his vital signs closely and adjust the dosage as needed. I also want to discuss lifestyle modifications with him. Regular exercise and a healthy diet can significantly improve his heart health.
That's a good idea. I can schedule a session with the cardiac rehabilitation team to provide him with personalized guidance, Dr. Mihiraa.
Thank you. It's important to involve Mr. George in his care plan. He needs to understand the importance of lifestyle changes and medication adherence.
Now look at question 29. You hear a surgeon called Mihiraa talking to the team. Now read the question.
Team, we're about to begin a complex surgical procedure. It's crucial that we all remain focused and follow the established protocols.
We're ready, Dr. Mihiraa. We've reviewed the patient's chart and prepared the operating room.
Excellent. Remember, this patient has a history of allergies to certain medications. Please double-check the medication chart before administering anything.
I'll ensure that the medications are verified. We should also have a backup plan in case of any unexpected reactions.
That's a good point. We need to anticipate potential complications and be prepared to respond accordingly.
What about the patient's blood type? We need to ensure we have the correct blood products available.
Yes, please verify the blood type with the blood bank. We'll need to have blood products ready in case of significant blood loss.
I'll double-check the patient's medical history for any previous surgical procedures or complications, Dr. Mihiraa.
Great. Remember, our goal is to provide the best possible care for this patient. Let's work together as a team to ensure a successful outcome.
Now look at question 30. You hear a dietitian called Mihiraa giving a class to nurses. Now read the question.
Nurses, it's important to prioritize your own well-being to provide the best possible care to our patients. That includes maintaining a healthy diet and staying hydrated.
I know, Mihiraa, but it's hard to find time to eat properly when we're so busy.
I understand. Try to pack healthy snacks and meals to have on hand. Even small changes, like replacing sugary drinks with water, can make a big difference.
I'm worried about gaining weight due to stress eating.
Stress eating is common, but it's important to find healthy ways to manage stress. Try incorporating relaxation techniques like yoga or meditation into your routine.
I'm not sure what to eat to stay healthy and energized, Mihiraa.
A balanced diet with plenty of fruits, vegetables, whole grains, and lean protein is essential. Avoid processed foods and sugary drinks.
That is the end of Part B. Now look at Part C. Part C. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36. You hear the conversation between an anesthesiologist, Dr. Mihiraa, and an interviewer.
Dr. Mihiraa, thank you for joining us today. To start, can you elaborate on the fundamental role an anesthesiologist plays in the medical field? The general perception often reduces it to just putting patients to sleep during surgery, but I'm sure there's much more to it.
Thank you for having me. Yes, the role of an anesthesiologist is often misunderstood or oversimplified. Our primary responsibility is to ensure the safety and comfort of patients before, during, and after surgical procedures. This involves not only administering anesthesia, but also monitoring vital functions such as heart rate, blood pressure, and breathing throughout the surgery. We tailor the anesthetic plan based on the individual's health, the nature of the surgery, and any pre-existing conditions. It's about finding a delicate balance between rendering the patient unconscious and ensuring they remain stable so they don't experience pain or wake up during the procedure. Beyond the operating room, anesthesiologists also manage acute and chronic pain, respond to emergencies, and assist in the critical care of patients in intensive care units. Essentially, we are guardians of the patient's physiological stability throughout the entire perioperative period.
That's quite an expansive role, far beyond what many people might imagine. Could you share a bit about your journey into this field, especially during the initial stages of your career? What were some of the experiences that shaped your early professional life?
My path into anesthesiology was not a straightforward one. Initially, I was drawn to surgery, but during my rotations, I found myself captivated by the science of anesthesia and the complexity of managing the human body's responses to surgery. My early years were spent in a rigorous residency program where I was exposed to a wide range of cases, from routine procedures to highly complex surgeries. The learning curve was steep, and I often found myself grappling with the pressure to make quick, yet informed decisions that could mean the difference between life and death. One of the most memorable experiences was managing anesthesia for a critically ill patient who had multiple comorbidities. It was a challenging case that required constant adjustments to the anesthetic plan. It was then that I realized the importance of being adaptable, staying calm under pressure, and thinking several steps ahead. These experiences, though daunting at the time, laid the foundation for my expertise and instilled a deep respect for the role anesthesiologists play in patient care.
Those initial experiences sound intense. With such high stakes, challenges in treatment must be common. Can you discuss some of the specific challenges you've faced in your practice and how you've managed to overcome them?
Challenges in anesthesiology are indeed frequent and varied. One of the most significant challenges is managing patients with severe allergies or reactions to anesthesia. For instance, I once encountered a patient who had a rare condition that made them hypersensitive to common anesthetic agents. The challenge here was to devise an anesthetic plan that would be effective yet safe for the patient. This required extensive research, consultation with colleagues, and even collaborating with pharmacologists to explore alternative drugs. Another challenge involves managing unforeseen complications during surgery, such as a sudden drop in blood pressure or an unexpected reaction to a drug. In such situations, rapid decision-making and improvisation are crucial. Over time, I've developed a systematic approach to these challenges: thorough preoperative assessments, clear communication with the surgical team, and staying updated with the latest research in anesthetic techniques. By anticipating potential issues and having contingency plans in place, I've been able to navigate these challenges effectively.
Navigating such high-pressure situations must take a toll personally as well. How do you manage the personal stress that comes with your profession? Balancing such a demanding career with personal well-being must be difficult.
Personal stress is an inevitable part of being an anesthesiologist, given the critical nature of our work. Over the years, I've learned that managing stress is as much about mental resilience as it is about physical well-being. I make it a point to maintain a healthy work-life balance by engaging in activities outside of medicine that rejuvenate me, be it spending time with family, practicing yoga, or even painting. Another crucial aspect is having a support system, both at work and at home. I've been fortunate to have mentors and colleagues with whom I can discuss challenging cases or seek advice, which has been invaluable in alleviating the mental burden. Additionally, I practice mindfulness and meditation, which helps me stay focused and composed, especially in the operating room. It's also important to recognize when to seek professional help if the stress becomes overwhelming. Over time, I've come to realize that self-care is not just a luxury, but a necessity in this field.
It's inspiring to hear how you've managed to balance the immense demands of your career with personal well-being. What would you say is the main lesson you've learned so far in your career?
If I had to distill it into one main lesson, it would be the importance of continuous learning and adaptability. Anesthesiology is a field that is constantly evolving with new research, technologies, and techniques. Staying stagnant is not an option. Every patient is different, and what works for one might not work for another. Therefore, it's crucial to remain curious, keep learning, and be willing to adapt your practices. I've learned that humility is essential, acknowledging that there is always something new to learn and that mistakes are opportunities for growth. Another key lesson is the importance of communication. No matter how skilled you are technically, the ability to communicate effectively with patients, their families, and the surgical team can significantly impact outcomes. Lastly, I've learned that being compassionate and empathetic is as important as being competent. Patients are often scared and vulnerable, and a few reassuring words can make a world of difference.
Those are profound insights. Lastly, what advice would you give to young, aspiring anesthesiologists who are just beginning their journey in this field?
My advice would be to embrace the challenges and the learning process. Anesthesiology is a demanding field, but it's also incredibly rewarding. It requires a unique blend of scientific knowledge, technical skill, and emotional intelligence. I would advise young anesthesiologists to never stop asking questions and seeking knowledge. It's also important to build a strong network of mentors and colleagues who can guide you and provide support. Another piece of advice is to cultivate resilience and patience. There will be days when things don't go as planned, and it's easy to get disheartened. Remember that each experience, whether good or bad, is an opportunity to learn and grow. Finally, take care of yourself. The demands of this profession can be overwhelming, but maintaining your physical and mental well-being is crucial to sustaining a long and fulfilling career.
Now look at Extract 2. Questions 37 to 42. You hear the President Dr. Mihiraa talking about the latest architectural blueprint for the Mihiraa Research Center. You now have 90 seconds to read questions 37 to 42. Good afternoon, esteemed colleagues and guests. Today, I will be sharing with you the findings from a comprehensive study conducted at the Mihiraa Research Institute, where we delved into the effects of energy drinks and protein powders on human physiology. Over the course of 18 months, our team conducted 859 meticulously controlled trials, involving a diverse participant pool of varying ages, fitness levels, and dietary habits. The trial was designed to explore not only the short-term effects of these popular supplements, but also their long-term impact on health, behavior, and performance. The trials were structured into 3 phases. The initial phase focused on baseline measurements of participants. The second phase involved the administration of either energy drinks or protein powders under controlled conditions, and the third phase was the post-administration analysis. Our goal was to capture a comprehensive set of data that covered biochemical markers, physical performance metrics, and psychological well-being. Each participant was monitored closely, with frequent assessments to track any physiological changes, behavioral shifts, or adverse reactions. The robustness of our methodology is evident from the granularity of the data collected, which spanned over 50,000 individual data points. The rationale behind this extensive study stems from the increasing prevalence of energy drinks and protein powders in the market, coupled with the growing concerns regarding their safety and efficacy. While these supplements are marketed as beneficial for energy enhancement and muscle growth, the scientific community remains divided on their long-term effects. Energy drinks, in particular, have been associated with heightened risks of cardiovascular issues, while protein powders have sparked debates over their potential impact on kidney function and hormonal balance. Given the popularity of these products, especially among younger populations and athletes, it became imperative to conduct a study that could provide empirical evidence of their true effects. We aim to move beyond anecdotal reports and limited studies by conducting a trial of sufficient scale and scope. The Mihiraa Research Institute, with its state-of-the-art facilities and interdisciplinary team of researchers, was the ideal setting for such an endeavor. We were particularly interested in understanding whether these supplements deliver on their promises without compromising long-term health and whether certain populations might be more vulnerable to adverse effects. The results of our trial were both illuminating and, in some respects, unexpected. For energy drinks, we observed a significant increase in alertness and physical performance within the first 30 minutes of consumption. However, this initial boost was often followed by a sharp decline in cognitive function and increased anxiety levels within 2 hours post-consumption. Biochemical analysis revealed elevated levels of cortisol, a stress hormone, which correlates with the heightened anxiety reported by participants. In contrast, protein powders showed a more complex set of results. While there was a clear improvement in muscle synthesis and recovery times among those who engaged in regular strength training, there were also indications of potential strain on renal function, particularly among participants who consumed protein in excess of recommended dietary allowances. Furthermore, a subset of participants reported gastrointestinal discomfort, which we linked to the presence of certain additives in the form of protein, e.g., whey versus plant-based, used in the powders. Overall, the data suggests that while these supplements can provide certain benefits, they are not without risks, especially when consumed irresponsibly or by individuals with pre-existing health conditions. These findings underscore the importance of personalized nutrition and the need for consumers to be better informed about what they are putting into their bodies. The implications of our findings are far-reaching, particularly in the context of public health and consumer behavior. For many, energy drinks are a quick fix to combat fatigue, especially in high-pressure environments such as academic settings or demanding jobs. However, the trial's results suggest that the temporary benefits of these drinks may be outweighed by the longer-term costs to mental health and cognitive function. This raises critical questions about the role of such products in society and whether regulatory frameworks should be reevaluated. Similarly, the use of protein powders, often seen as a cornerstone of fitness regimes, needs to be approached with caution. While they are undoubtedly beneficial for muscle recovery and growth, our research highlights the potential for adverse effects if not used appropriately. This is particularly concerning given the trend towards high-protein diets and the widespread belief that more protein equates to better results, a notion that our trial challenges. These findings are expected to influence both individual choices and broader public health policies. Educational campaigns may be necessary to inform the public about the risks associated with these supplements, and healthcare providers may need to consider these factors when advising patients, particularly those with underlying health issues. Looking forward, it is clear that more research is needed to fully understand the long-term implications of energy drinks and protein powder consumption. Our trial, while comprehensive, was limited to 18 months, and the full spectrum of potential effects, particularly those related to chronic consumption, remains unexplored. Additionally, the diversity of products on the market, each with its unique formulation, suggests that there could be significant variability in outcomes depending on the specific brand or type of supplement used. One of the most intriguing areas for future research is the interaction between these supplements and other dietary or lifestyle factors. For example, how do energy drinks affect someone who already has a high caffeine intake from other sources, or how do protein powders interact with other aspects of a high-protein diet? Understanding these interactions could lead to more tailored recommendations and potentially safer consumption practices. Moreover, there is a need to explore the psychological and behavioral impacts of these supplements further. Our trial indicated that energy drinks, in particular, could contribute to increased anxiety and potentially addictive behaviors. Investigating these aspects could provide valuable insights into how these products influence not just physical health but overall well-being. Based on our findings, the next steps are multifaceted. Firstly, we plan to publish the detailed results in peer-reviewed journals to ensure that the scientific community can scrutinize and build upon our work. This will also pave the way for more nuanced discussions on the safety and efficacy of these supplements. Secondly, we are advocating for more stringent labeling requirements and regulations for energy drinks and protein powders. Our research suggests that current labels may not provide sufficient information about potential risks, particularly for vulnerable populations. We also propose that healthcare professionals receive more training on the potential implications of supplement use so that they can better advise their patients. Finally, we aim to collaborate with other research institutions to conduct longitudinal studies that will track the long-term effects of these supplements. This will involve not just physiological assessments but also psychological and behavioral monitoring to provide a more holistic understanding of how these products impact health over time. That is the end of your OET listening test. Now check the answers.